Hello and welcome to Spokane County Spotlight. I'm Commissioner Al French, and my guest today is Dr. Veena Singh, Spokane County's Chief Medical Examiner. Dr. Singh, welcome to the program.
Thank you for inviting me to be here.
Before we get started, Dr. Singh, for the benefit of our audience, could you give us an overview of yourself and your background?
Yeah, so I attended medical school in my hometown, Portland, Oregon. I graduated medical school with a medical degree and also a master's degree in public health. After medical school, I spent 2 years of specialty training at Swedish Medical Center in Seattle. And then I moved to Albuquerque for specialty training in pathology and subspecialty training in forensic pathology. And since finishing my training, I have been working as a forensic pathologist in medical examiners offices in Arizona, New Mexico, Minnesota, and now here in Washington.
Wow, that's quite a path to get to this point.
Yes.
Well, congratulations.
Thank you.
What inspired you to pursue a career in the medical field?
I have always been fascinated by the human body, why it works, why it doesn't work, what happens when things break down. And I'm also really intrigued always by people's stories. What are their lives like? How did they get to where they are? So medicine seemed like a really great way to combine those two interests.
So before we get into your work as a medical examiner, could you tell us a little bit more about your time working in surgery at the Swedish Medical Center in Seattle?
Yes, that was a really formative 2 years for me, learning about general surgery, trauma surgery, learning about how to examine trauma patients and surgery patients, how to treat them. I, in that time, acquired a lot of technical skills there, a lot of good knowledge that has really informed my practice as a forensic pathologist.
Terrific. So how was your experience as a medical examiner in Minnesota?
That was really great. So I went there, I'm always fascinated by the variations in deaths and death investigation from state to state, from region to region. So that I had never lived in the Midwest before. I went from a larger kind of academic medical examiner practice to a small community-based medical examiner practice, and from the desert to the land of lakes, where it also gets really, really cold. So I learned a lot about winter, and it was really just a great growth experience for me.
So you've certainly been in a lot of very populous areas in your career.
Yes.
So what motivated you to want to take on the challenge of Chief Medical Examiner here in Spokane County?
So I had come to the point in my career where I felt like I was ready to step into the responsibility more of leadership. And as I was looking around at the many open positions, Spokane really rose to the top very quickly. It's a great, well-established office, community-based office that has a lot of support from county leadership, as evidenced by the fantastic new facility that they were moving into at the time that I was looking. So it was really a pretty easy decision, actually.
So I'm sure many in our audience would probably appreciate learning a little bit more about the roles and responsibilities that you have as the county's Chief Medical Examiner. Could you talk a little bit about that?
I can. So I am one of 3 forensic pathologists in the office. So I share in working up cases, examining medical records, doing the autopsies, going to court, kind of all the nitty-gritty of death investigation. As chief, I also have responsibility for oversight of the office. So determining whether we have adequate staffing and resources to meet our responsibilities, making sure that we have the right policies and procedures in place to support our operations, making sure that staff are performing at a suitably high level. And then in the bigger picture, the information that we gather through death investigation doesn't just benefit the family or law enforcement or the courts in that particular individual case. It's also used to improve health and safety in the community. So for example, if you have the information about why an injured patient died can help doctors figure out how to better treat those patients, similar patients in the future. If we have information about where motor vehicle and pedestrian deaths occur, that can inform city planners, county planners to determine what intersections or roads are particularly dangerous. So one of my roles is to make sure that the information we gather is being reported and shared with the appropriate people in the right manner. And then in the bigger picture, we always want to make sure that as an office, we're using our skills, our knowledge, our physical facility, all of our assets to really enhance public safety safety and public health in the region. And so looking at, are there things that we can reasonably add to our operations that can support those endeavors? And if so, how can we add those things?
So the public probably interacts with your office primarily through the news media when there's the potential of a homicide. Your office is the one that determines the cause of death.
Correct.
And whether it constitutes a homicide or not.
Yes.
And stuff. So talk a little bit about that relationship you have with the prosecuting attorney's office and the role you play in that process, because that's probably where the public sees the medical examiner has determined. And
Right. And I think a lot of people think that's all the medical examiner does. But yes, that's probably the more kind of high profile thing that the office does. So yes, we do, it's always our mandate to determine the cause and the manner of death. So how somebody died and the circumstances in which they died. And sometimes that does turn out to be a homicide. And that's part of our public safety, I guess, mandate, in that we really, that information then assists law enforcement and assists the prosecuting attorney's office in determining whether someone should be prosecuted and then furthering that prosecution.
well, and the role of the medical examiner really has become much more visible to the public because of the TV shows that have now formed around the role of the medical examiner, whether it's CSI Vegas or some of the other shows and stuff. So people see that on TV. How close is that to what you really do?
Well, in the sort of broader view, it's similar in that it does show that we investigate deaths and determine the cause and manner of death, but really is not realistic at all in kind of the how it unfolds on TV and the speed at which it unfolds on TV. So there's a lot more just kind of, grinding through a case. Sometimes it's not as pretty as it looks on TV, or, they don't show you how things can smell sometimes. And so it's very interesting work, but it's not always as glamorous as it looks on television.
So you're not ready to hire an agent and go, no, okay. No. So you were hired by the Board of County Commissioners back in April. So can you share with us how these first 6 months have been and how you've been able to get your feet under you and get rocking and rolling? Because not only did you step into this position, but you stepped into it with a brand new facility as well.
Right. Yes, it has been a lot to learn. So just even learning the office, the structure of the office, the function of the office, and then, like you say, transitioning into the new facility, and how does the structure and function change now that we have a much bigger facility to manage, and then trying to figure out also the structure and function of the county, how our office fits within the county. All of that has just been, it's been a whirlwind of learning new stuff. But I am so grateful to have what an amazing group of people that work around me at the medical examiner's office. Collectively, they've got a lot of wisdom. They're very passionate, dedicated individuals. So that has been really the biggest part of helping me get up and running and up to speed on things.
The citizens of Spokane County are really been very lucky because your predecessors, Dr. Howard and Dr. Aiken, were nationally renowned medical examiners and have done a lot to establish really good program that you're now not only inheriting but are growing and stuff. So this is very significant in the state of Washington. So now that you've settled in, what has been one of your more surprising things that you've learned about living in Spokane County?
So it sounds bad to say, but I have been surprised at how much is going on here in Spokane. I had an image of it as being a small town, and it does have some elements of a small town in that it's a very friendly place. It's a perfect size to kind of get around, but there's a lot happening here in terms of restaurants and culture, and then the surroundings are so beautiful. It's been a really great place to explore and settle into as a place to live.
Yeah, I always think of Spokane as the largest small town in the country.
Right, that's accurate.
Even though we're well over 500,000 in population now, it still has that small hometown feeling. You can still walk down the street and see people and say hi, and even you don't know them, they're still very friendly and stuff. So
Yes.
I've always appreciated that about Spokane. So from your point of view, what has it been like to provide the community forensic services during this new era of COVID-19?
Wow, this has been a really challenging time to be
Yeah.
in medicine in general, but in death investigation in particular. It's not just the incredible rise in deaths due directly to COVID, but also there's sort of an accompanying epidemic of drug overdose deaths. Those have really skyrocketed. We've had an increase in homicide deaths here in the community, and a really remarkable increase in traffic-related deaths, which is strange. And so that has really stressed the system in terms of keeping us at our current level of staffing. We're really scrambling to kind of keep up with everything and keep current on our responsibilities.
I also understand from the mental health community that there's an increased level of anxiety, depression, and suicides. And I don't know whether the suicide rate has increased, but I know the pressures on the mental health system has also increased. Are you seeing any of that in your office as well?
Well, I have to give credit to the mental health systems here. We've actually seen a very slight decrease in suicides during the pandemic years, maybe 5-6% decrease. So that a credit to them for, despite the increased pressures, the anxiety and depression, as you say, it hasn't resulted in an increase in deaths yet.
So with the new strains of the COVID vaccine, or the COVID pandemic, is the science progressed to the point to where you can tell the difference between whether it's the initial COVID, whether it's the Delta, or now the Omicron?
Yes, so the science has progressed to the point where we can detect the different strains.
Okay.
And so that's going to be really helpful going forward to determine, right now, the original variant has been pretty much supplanted by the Delta variant. So now it'll be interesting to see the Omicron variant. Is this going to overtake Delta, or are we still is it the biggest threat still going to be the Delta variant?
So your predecessors, as I mentioned earlier, Dr. Howard and Dr. Aiken, had a well-established presence here in the community. How has your experience been so far with the transition?
I have been so gratified at how welcoming the community has been here. Before I even figured out how to get to the office from my house, I had people reaching out to me from the community. Those people connected me with other people. Those people in turn put me in touch with other people. So before I even knew what was happening, I had a professional network already that I could reach out to for guidance, for assistance. So that has been really amazing. And I'm also really grateful to Dr. Aiken. She has been a kind and supportive mentor to me as I have stepped into this role, and I'm sure it has been really difficult for her to give over stewardship of this office, as she was so integral in growing the office and getting it to this point. But she has been very graceful in the transition, and I've been really grateful for that.
Yeah, I know that both the doctors were very, very passionate, not only about what they did, but leaving, because both of them now have retired, but making sure that when they left the county in good shape.
Yes.
And part of that was a project that I worked on for many years prior to your arrival, and that was advocating to secure support and funding for the new medical examiner's office. It was thrilling to see this dream become a reality in June of last year, when we were able to cut the ribbon on the brand new 24,000 square foot facility. Could you give our audience a little bit of an overview of what that means to you to have this updated facility, and maybe more opportunity, or more importantly, how this benefits our community?
Well, yeah, so this building, as an individual medical examiner, this building, it's a great building, it's a marvelous place to work, but it also to me signifies that this office, or this death investigation system, is under a county government that really is dedicated to public health, public safety, is dedicated to supporting and recognizing how important a robust death investigation system is to those areas. And this is a place where any medical examiner would like to work in that situation. Anyone in death investigation would like to work in that kind of circumstance. So it's been at the individual level, a really great place to start to get established. But it's also, as you mentioned, a great community asset. This new facility, this space, is a very welcoming space for education, for training. It provides us the space to assist the community or the region in a mass fatality incident, and whether that's a single incident like a mass shooting or this ongoing mass fatality situation that we're in with the pandemic, it really provides us a way that we can support local hospitals, local funeral homes when their morgue space is overwhelmed, for example, so that in Spokane County we won't have to be those people on the news that are storing their bodies in tents or in ice rinks. We have the facility where we can provide that support. And then as the area grows, it also allows the office to grow with the area and support the death investigation needs, because we have the space again in the new facility for that.
Well, it was the doctor's goal in mind to make sure that we had the state-of-the-art facility, but it's not just the facility, it's also new equipment that is also made available through this facility to assist you in the work that you do. Yes. Can you talk a little bit about some of the equipment that is now in there that previous doctors didn't have?
Well, so there is a new X-ray machine. It's a single a scanning X-ray machine, and it really allows us to image bodies very quickly, so that we can use that image for triaging, looking for bullets, for identification. And this is a marked increase in or improvement in what we had before. So before, they had the doctors and techs had to use X-ray plates. They had to move the plate around the body. It took a long time to get an X-ray. And in this system, we can just lay the body on the table and quickly scan it. So that has been really tremendous. We have great new autopsy tables, again, with a lot of space, good lighting for working. So just, it makes each individual case a pleasure, and it allows us to process a lot of cases that increasingly we're needing to do.
Well, even cadaver storage has been significantly enhanced over what it previously was. Many in the audience might not know that for years, the medical examiner's office actually functioned in the basement of Holy Family Hospital. Yes. And so very grateful to the hospital for allowing us to share that space with them and stuff, but it was not designed to be a medical examiner's facility and stuff, and so it lacked a lot of the amenities and actually a lot of the efficiencies that the new building provides. Right. When we were looking for the site, we could have located this facility really anywhere in the county, but we were very deliberate about trying to make sure that we could locate it adjacent to or in proximity of the new medical schools, because there was an opportunity to allow for training of new medical students and stuff. And so we'll talk about that in a little bit here, but there's been some additional big news coming to your office regarding partnerships with the local university medical schools. Could you share us with some of the details about this exciting opportunity?
Yes, this is a really exciting opportunity. So we have formalized our relationships with both medical schools here in the region, and this is going to be a great opportunity. I think showing medical students what diseases actually look like in the body. What does it look like when someone has a stroke, when they have a heart attack, when they overdose on their prescription pain medication? These are things that are really valuable for students to see, so that when they go out and start taking care of their own patients, they have an idea of what's happening, how the body fails, how they can better treat those failures. And then again, sort of on the bigger picture, death investigation provides a really important perspective, I think, on how our systems fail people. How do people fall through the cracks? How do the public health and public safety, the medical care systems, how do they not meet people's needs? And providing that perspective for clinicians in training really gives them a better context in which to take care of their patients. And ultimately, our goal is to turn out better doctors, and I think we're in a good position to help with that, help the medical schools kind of provide those experiences.
Well, with a brand new medical examiner's facility and 2 brand new medical schools with all the students, it's a great opportunity, and it's a significant turning point for Spokane County. But so beyond your busy day-to-day work, what are some of the other long-term projects you're working on for the future of the medical examiner office?
So we do have some things underway. So on the topic of education, we're working on developing a college internship, actually, and that's another thing that hasn't really existed. It hasn't existed on this side of the state, and so there's a lot of pent-up demand for that. We're in the process of putting that together. We actually just welcomed our first intern from Gonzaga. We have somebody in the pipeline from Whitworth University, and we're working on agreements with Eastern Washington University too. So that's going to be an exciting thing coming down the pike. We're working on developing some kind of mock scene-based educational experiences that would be appropriate for high school students to start doing some community outreach in that regard. On the area of service augmentation, we're looking at ways in which we could make space available in our facility for tissue donation agencies to increase the number of lives that can be improved or saved by tissue donation or transplantation. So yeah, there's never a dull moment around our office, for sure.
Well, that's exciting to hear about the new program being created and stuff. I know when we were looking to find a new medical examiner to replace Dr. Aiken and Dr. Howard, there's not an abundance of folks in your profession out there. I mean, you're not going to go down to the local employment office and find one. We actually engaged in a national search, and we were very fortunate to find you, but I think the fact that we had brand new medical facilities, brand new equipment, the medical schools adjacent to it, all of those added up to be able to bring somebody to the community with your skill set and your quality and stuff. So thank you for agreeing to come to Spokane County.
Thank you.
It's a real plus up for us. So as we begin to wrap up our conversation here today, I think our audience would be surprised to learn that the Spokane County Medical Examiner's Office also serves 13 outside counties in Washington and Idaho, working on thousands of cases each year. I'd really appreciate your perspective on the service that we provide to the region.
Yeah, so I think that is another thing that people would be surprised to know. As you say, this office really is a regional asset in the sense that we provide these specialty services, specialty skills to the entire region. And as you mentioned, there is a shortage of forensic pathologists throughout the nation, but it's becoming quite severe here in Washington. And this office with our new facility is very well positioned to develop even further our regional role in death investigation. And so, yes, we have a good kind of groundwork in that, and we're positioned to grow that part of our operation too.
So in addition to what Spokane County offers with regard to the position of medical examiner, the community obviously has a number of other intrinsic values, whether it's recreational opportunities, educational, or what if those assets were appealing to you when you were looking at Spokane and saying, you know, that's a community I think I could find a position in?
It really is the whole picture. There's so many things that are attractive about Spokane and Spokane County. It's professionally, we've talked about what a great opportunity and a great office this is. But yes, so just the surroundings, the abundance of natural beauty out here, the size of the town itself, and yet all of the things that are happening here. This is closer to my family, so that's also a really a big plus for me. So yeah, just the whole picture here is, I think really this is an area that it kind of has it all, if you will, in the sense of things that are activities to do, outdoor things to happen, and just the nice community feeling that's here.
So are there any things that would be improvements that we could continue to make to the medical examiner's facility or process that you've seen now that you've been here for 6 months that you would like to say, you know, I wished we could do this, or I wish we could have this to improve the quality of service that we provide to our citizens?
So I spend a lot of time thinking about this, as you can imagine. I think right now our biggest challenge is staffing, really. And so to ultimately try to increase our staff so that we can offer some of these, not just the basics of death investigation, but these extra things, these perks of like educational things, community outreach things, that's a big one. I think in terms of equipment, eventually it would be nice to have a CT scanner for teaching and also for our own operations that could augment our exams. So those probably would be the two bigger things at this time, the staffing being probably the more pressing need than the CT scanner.
So if part of our conversation we piqued the interest of somebody out there in the audience and they're thinking, you know what, I might be interested in pursuing a career in this field, what would you suggest as a way to get started? Or what are some of the skill sets you're looking for people that would work with you and fill some of these positions that are open in your office?
So there's a variety of positions involved in death investigation. So we have death investigators who go to the scenes, they gather information about cases. We have autopsy assistants who work in the autopsy suites, assisting us with the autopsies and drawing specimens and learning how to package evidence, that type of thing. There are forensic pathologists, obviously, so that would involve a higher level of training, so going to medical school, doing the specialty training. We have administrative positions in which people manage our records. They interface with the public really to provide information to them and release property to them. So each area has a different skill set involved. And so I would encourage people to first think about what area they wanted to work in, and then they can reach out to the medical examiner's office. We have a website, and there's a general email box if they have particular questions about what might be available in the future or learning opportunities that might be available to them.
So you don't necessarily have to have a medical degree to be able to work in your office. There are a
Correct.
variety of different skill sets and functions that somebody could provide.
Exactly right, yes.
Excellent, excellent. And as far as the location of the facility, it's on the south side of the new bridge, Arch Bridge, going into the University District. And the facility is located, I think it's First in Spokane.
Yes, on the front is on Spokane Street, right down at First, yes.
Yeah, and stuff. So it was an existing building that the county bought and remodeled to accommodate this office and stuff. And we were very fortunate to find a building that had the right size, but more importantly, the right location and proximity to the universities and the medical schools and stuff. So we were very lucky in that way. So we're getting to the end of the show, so on behalf of the board, I'd like to say that we are very excited to have on our Spokane County team Dr. Singh. And in our last minute, are there any other messages you'd like to share with our audience?
I just want to thank the community for trusting us with this important responsibility, and I want to thank the county for supporting us in this endeavor.
You bet. Dr. Singh, I've enjoyed our discussion, and I think our viewers have too, but I'm afraid we've run out of time. I'd like to thank my guest, Dr. Veena Singh, for joining us today. As a reminder, a video of today's Spotlight can be accessed on Spokane County homepage and on Spokane County YouTube channel. I'd also like to remind our audience that Spokane County has a mobile app which connects citizens to a wide variety of Spokane County services. The Spokane County On the Go app can be downloaded for all Apple and Android devices by simply visiting your app store. Download the app today and connect with Spokane County. I'm County Commissioner Al French. Thank you for joining us today on Spokane County Spotlight.